When I talk about biomedical waste management, so my question 2A is going to be, what is biomedical waste management? Biomedical waste management. First of all, when I talk about biomedical waste management, I have to define what is biomedical waste. So biomedical waste is defined as the waste that is created or generated during the diagnosis, treatment or management of any patient. It can be during their disease का course या फिर research में. So first of all, it is going to be the waste generated during the treatment and diagnosis of any person in a hospital, because it comes to us, it comes to a hospital. हम लोग research का कुछ ज़्यादा बात नहीं करने वाले. It also includes, the management also includes various steps. Those steps are very essential while creating various categories in this biomedical waste, and hence these categories have been amended in 2018. So the categories now include, you all would already know, सबसे पहले आने वाला है मेरा yellow bag, then I'm going to have a red bag, then I'm going to have a blue bag, and also going to have a white bag or a white box rather होगा. Yellow may I'm going to be putting all the anatomical waste. My anatomical waste can be any body organs or body parts, or any clothes, or any thing that is soiled with blood or body's fecal content, or any of the body's fluids. Apart from that, even the discarded medicines that have been discarded because they are not used, or those expired medicines are going to be put in the yellow bag. And urine bag is one specific thing that should you think would go in red bag, but it goes into a yellow bag. So all these things are going to be disposed in the yellow bag. So all the anatomical waste and soiled products are going to be put in the yellow bag. So anatomical waste oblique soiled products. In the red bag, you are going to have all the recyclable items. So in the recyclable items, it contains anything like the tubings, bottles, syringes, IV sets, IV lines, all those things which can be recycled, which are made of plastic, and they are going to be things that can be recycled, are going to be put in the red bag. In the blue bag, I'm going to be putting all the glassware, all the broken glassware and metallic implants, like hip joint का जो हम लोग implant डालते हैं, वो सब जो implants रहेंगे वो उसमें डालना है. And finally the white, you are going to put all the sharps, like your needles, scalpels, blades, etc. How do you create this? So there are a few steps in biomedical waste management that you have to write. What are the steps? The first step is going to be, सबसे important is going to be segregation. Segregation में you are going to separate at the point of creation. So wherever this is created, that is basically you as a doctor, when you are disposing it, the waste has been created in your wards. At that point, there has to be a segregation, and you should have these 4 containers, different colored containers that are present, those bags that are present in your ward. This is going to help. Segregation is going to help in proper disposal, and is also going to help the people who transport these items. It is going to help them be safe themselves. So segregation is very important. After that, there has to be कलेक्शन. सब वार्ड्स का कलेक्शन होगा और एक जगह पे कहीं पे तो हॉस्पिटल में आके स्टोरेज होगा. So the storage has to be kept hygienic, and these things cannot be kept at one place. They cannot be stored at one place for more than 48 hours. So ideally every day, this place where it is collected and all these things are stored from the entire hospital has to be sent to the place where these items are going to be processed. So collection and storage is going to be the second thing. Third is going to be, once they are collected and stored, they have to be transported to a facility where they will be treated and disposed. So transportation has to be ensured so that there is no leakage at all from these products, and they are transported safely. There is no leakage, there is no spill which can cause harm to other people or even the people transporting it. So it has to be a safe transportation process. Next, there is going to be treatment and disposal. Each thing has a different way of disposal. The ones in the yellow bag are going to be incinerated. They are basically going to be burned completely. The ones in the red bag, they are going to be autoclaved or treated with chemicals. And then they can be buried or recycled. The ones in blue bag, They don't need any specific treatment. They are just thrown away because it contains nothing more. They are just treated and thrown away. And the last one is going to be sharps. These are encapsulated and shredded and buried. Basically इनको shred टुकड़े करके इनको capsules लगा के basically properly cover करके they are going to be destroyed. So that is how you are going to be putting it, and everything eventually goes into landfills. Those landfills have to be ensured are kept away from residential areas because it can affect the groundwater and everything. Lastly, there is going to be a proper documentation. So proper documentation of all this process that was done, a checklist has to be maintained so that this entire chain is not distorted. It has to be mentioned. So documentation and auditing is very important to ensure that everything is occurring properly. So documentation, and if there are any problems, then even reporting has to be done so that the problem can be solved. So these are the five major steps that you would be taking. These are the major five things that you would be doing in biomedical waste management.